Okay, so I'm gonna work, like I said, from kind of the neck all the way down to the other end. Okay, so last week we really kind of focused on the superior aspect of the respiratory system. We could see and we isolated out, this is a nice looking larynx. We look at ours, that big box would probably be called the thyroid cartilage. Okay, right on top of the trachea would be the thyroid gland, and that's where that name comes from. Now, you can see the trachea really nicely on this one. They did a really good job on theirs, and kind of sitting off to the side here, and a little bit kind of underneath is the very distinct esophagus, which is the food tube that delivers the food to the stomach. Okay. Now as I kind of open up the chest a little bit more, here's the obvious heart with the various lobes of the lung on both sides. Sitting on top of the heart is this kind of blackish looking bilobed organ, which is the thymus. This is the best cat to show the thymus. The other ones, for whatever reason, just didn't show up very well. Okay, so as I work my way down, you can see a very visible diaphragm. Okay, the diaphragm is this kind of half moon shaped muscle that allows our lungs to inflate. It sits directly on top of the lobes of the liver. We can see they have at least 4 lobes, and I think there's a 5th one kind of inside. Right here between this lobe is this green sac, which is the gallbladder that stores the bile that's produced by the liver. If I kind of lift up on the left side here, we can see a really nice visible stomach. This one happens to be fairly full. And if I lift up on it, here is their spleen kind of attached to the back side of it. And if I search hard enough here, I'll find a pancreas, which is what this organ right there is. Pancreas is always going to look kind of like a sponge. Okay. Now the stomach tapers and becomes the small intestine. Small intestine is all basically this, held in place by that clear mesentery with the blood vessels and lymphatic vessels kind of throughout. Okay. And then it's kind of true or false, or not true or false, but just kind of guess and check here until you find the large intestine. Okay, the large intestine in this cat is not as discernibly different as far as size goes. If you kind of hold them up, it's definitely visible. Sometimes the large intestine in cats is way bigger than the small intestine in diameter. And the very first segment of the large intestine is this blind pouch, which is the cecum. In humans, extending off of it would be the appendix. Okay. As far as cats go, really just knowing the cecum and then the rest is basically colon. They don't have the ascending, transverse, descending sigmoid colon like we do. Okay. They just have basically the colon and the cecum as far as I'm concerned. Okay. Now it will run out behind the bladder, which is shown right here. Okay. Now if I kind of move some of this, we can see a nice blue tint here is a kidney. There's one on each side. Okay, the kidney over there is visible as well. Okay, and this one has a very nice visible ureter that leads from the kidney down to the bladder. Okay. Now, not the best in this cat, but where the bladder tapers, you'll see the beginnings of the urethra, okay, which are parts of the urinary tract. Okay, since we're dealing with a male cat, we have some male reproductive structures. Okay, the scrotal sac is going to cover both testes. In this case, we've removed one of the basically halves of the scrotum to illustrate one of the testes. This happens to be his right testes, and right on top of it is the very visible cat penis. Okay. Now, the other day in lab or in lecture, we talked about the spermatic cord. The spermatic cord is the structure that contains blood vessels and the vas deferens that connects the testes to the abdominal cavity. Remember that the sperm that's made in the testes doesn't go directly to the penis, it actually comes up through the spermatic cord by way of the vas deferens and around the bladder. And so in a male cat, if you kind of hold the bladder back, there is usually two visible cords that kind of wrap around And in their cat, it's kind of snipped off, but you can slightly see it. It's going to have a kind of nice U-turn to it, and then it'll kind of disappear in behind the bladder. And the other class has a male cat, and theirs is very visible. And so it will have this kind of U-turn shape to it on both sides, and for whatever reason, both of them kind of got clipped. Okay. I think that's the structures. You can stop.